To me, informed consent can mean a couple of things. I think first and foremost, I tend to think of the piece of paper that's put in front of you right before surgery, where you need to sign. Essentially, you've been told all the risks and complications and that sort of thing. That said, I think that there's so much that has to get you to that point that you're actually comfortable signing that piece of paper and kind of heading into surgery with your child.
Yeah, I agree. I think you don't want any surprises when you get to the point that the form's being signed. It's not really the time to be weighing risks or what the benefits are of the procedure. So I do think that, to me, informed consent means having a good understanding before you make the decision to proceed with surgery as to why it's needed, why it's being recommended, what it entails, and what the possible risks or other complications could be from it.
To me, informed consent is all those things. And it also, for me, starts with the minute the procedure or the surgery is mentioned. When we start that discussion, that's when really, for me, when the informed consent begins. From that first contact with the surgeon, the nurse practitioner, the nurse. And it's also knowing what to expect afterwards. It's so important.
I think during the process of giving and getting informed consent, there's often so much information that's given, and it's often given somewhat quickly. And I often have felt that I wasn't given an opportunity to really say, can you clarify this, or I don't quite feel comfortable with this. And often felt that I was being rushed through informed consent because it was just sort of a bit of hospital business that needed to be taken care of rather than a critically important part of the patient experience. Dr. Buckmiller she really listened to me, and she gave me power as a patient. And I had felt like most patients do, is I felt very vulnerable, especially after the emergency surgery, especially with surgeons just coming in and fixing things. And she really let me decide and make decisions about whether or not I was going to have the surgery. She didn't force me to go either way. She just presented me with the facts in a very compassionate and understanding way.
So I think for me, informed consent really boils down to effective communication. I think, we as surgeons come to the table wanting to convey certain pieces of medical information, and there's a tendency to really feel driven to get this information out. But to me, I think it's more important really fundamentally at the beginning to establish that effective communication and make sure that our patients and families understand what we're saying, so the information is received in a way that they can understand. And I think that's in some ways a bit different from aligning expectations, because aligning expectations to me is all about making sure that I am providing what the family and the patient expects to receive, both in terms of what the treatment is and what the expected outcome is. And if our expectations are not aligned, then what I term a success may very well be a failure in the eyes of the patient and the family. So.
It's a misnomer to think that the informed consent happens when we're signing the form right before surgery. That's clear to me. So that what we've emphasized with this program, what we've learned from is that it's a process. It's that communication, and it starts with those first interactions with the patient in your clinics. Mm-hmm. Now, whether or not you physically sign the form at that time or not, I don't feel strongly. Sometimes it's actually, in my mind, wouldn't be appropriate. That it would put undue pressure on a family at that time. They're first meeting you. They're hearing about the risks. They're thinking things through. They want to talk to their spouse. So, yeah, it'll work differently for different practitioners, different models. ultimately, yes, there's a detail about signing that form, but that doesn't change the whole informed consent process that needs to take place.